First of all, thank you for spending the time to learn a little bit more about the Molina Healthcare in Ohio, and this will be the presentation for our 2021 product rollout. My name is Yvonne Blanco. I work at Insurance Advisors Direct as a broker sales manager and also our DSNP LIS specialist. If you want to learn how to do DSNP, learn how to sell year-round, please give me a call at 1-800-381-0977, extension 124. We will have this recorded in our YouTube library on our IAD site. That will be www.iadbrokerage.com. With that, I'll go ahead and have Latoria Whitfield, which is the broker channel manager for Molina in Ohio. Go ahead and present to us our Molina Healthcare.
Hi, thank you so much for having me. I appreciate being here.
Thank you.
Absolutely. We will go ahead and get started. First of all, welcome everyone, and I appreciate you taking the time. This will be our 2021 advanced screening. So this is the sneak peek at what we have coming up for this AEP. First of all, this just first page here, this is just thanking you. This is a letter to our partners, and we recognize you have options. There's many different choices out there, and we just appreciate you taking the time to consider Molina and to make you one of our choices. So yeah, we thank you for being here with us. What makes Molina unique? This is just kind of our circle of life. So this is just us saying, you know, who we are, where we've been. We've been around for 35 years. So we know how to do DSNP. We know how to do Medicare, Medicaid. And so that's something that we're very proud of. This is well, some of the compliments we've received, where our application process is easy. Our broker support unit is easy to do business with. We love to hear that our process is streamlined. So we feel like we're doing a lot of the right things, and we're definitely going in a direction of trying to do whatever you need. That's what we're here for. Benefits tailored to our members. So we have a lot of different plan offerings this year. Some of the great things is the increased dental allowance, increased vision, our over-the-counter benefits, personal emergency response system, and we'll talk a little bit more about that and what that means. And telehealth is also available. This is our national footprint. So this kind of lists the states that we are currently in and our expansion counties as well. So of all the states we're in, actually 8 of them are expanding in additional counties next year. So as you can see, we are growing, and it's something that we're super excited about. Again, this is just another snapshot of where we're growing at, and we'll focus on Ohio here because I am the Ohio rep. So 44 counties in Ohio, this is a big deal. We are currently in 27 as of 2020, and as of 2021, we're adding an additional 44. So we'll be in 71 total counties. This is kind of a different view of that same thing. So this lists all the counties that we were in. So again, this is a huge expansion for us. We have some great benefits to go along with this expansion, and definitely looking forward to dig into the benefits. Just here in the right-hand corner are some of our network highlights. So we'll just start here in the kind of the Cleveland area. Metro Health Systems is one of our hospitals. University Hospital is there as well. We have Mercy Hospital in Stark County, the Canton area. Summa Hospital is in our Akron area. The next bullet point there is the Columbus area. So James Cancer Hospital Center, Mount Carmel, Ohio Health, Ohio State and University. And then we have Cincinnati there with Tri-Health and UC Health. Montgomery County area, that's the Dayton area. We have Ketterling. And again, we do have Mercy Health Systems. So we feel like we have a robust network and definitely willing to expand on that as well. So those are just some of the highlights that we do have. And again, all the counties here that we have for 2021. So one of the benefits that we're super excited about, everyone's excited about, is our over-the-counter. For 2021, we have $350 per quarter. And that does have a carryover on it. So if a person doesn't use all of their benefits, they do not lose it at the end of the quarter. It does roll all the way until December 31st. Whatever they don't use by December 31st, they do lose it. Products are shipped at no charge. So there's 2 ways to order. You can order by catalog, by filling out the information. You can pick up the phone. You can order by the app, or a person can get the Visa debit card. If they choose to order by catalog, they will receive their items in 5 to 7 days. There's an amazing catalog that goes along with it. It's 450 products in it. It really, really is a nicely done catalog. And again, they do have the option to do a Visa debit card. If a person does want a Visa debit card, they do have to call the 800 number and request the card. It is not automatically sent to them. So that is something to keep in mind. They must call and request the card.
Latoya, on
Yes.
that over-the-counter, beautiful photo picture catalog, I'm a big fan of that. I know that the brokers will have their own copy, and just to kind of go over, the members will have their own copy mailed to them, right?
Absolutely. Catalog will come in their kit, so they will automatically get that in there. And like you said, it's a well done catalog. It kind of reminds me of a medic sup book. The thickness
Yes.
of it, yes, yeah, that's what I first thought of when I saw it. So yeah, it will automatically come in their kit, and the brokers will definitely have a copy of it as well.
Right, and as a side note, if any of the agents do need an over-the-counter IAD, or Molina will go ahead and provide one for you.
Absolutely.
All right, thank you.
You're welcome. And our dental benefit, this is something also that we are excited about and that we can definitely get behind. We have $2,500 available for dental, and this is for comprehensive dental. So what does that mean? That means that the preventative does not come out of the $2,500 limit. So if they need an oral exam, a cleaning, fluoride treatments, x-rays, that is all separate from the $2,500. They can also get dentures. Dentures are available every 3 years. So this is a benefit that people are excited about. We do have Delta Dental, which we have found has been a great network and has really worked well with us. So this is a good benefit. People need these kind of services, and $2,500, it seems to have gone a long way for a lot of people. So this is definitely a good benefit as well. And vision. So again, that we get $300 for an eyewear allowance, and a person can get glasses or contacts. It's completely up to them how they want to use that $300. There is no cost for the eye exam. So your eye exam is not coming out of that $300. That is a separate benefit. So zero cost for the eye exam and $300 for glasses or contacts, and upgrades are available for the glasses. Transportation. So the transportation is not for your ER visits. However, there are 60 one-way trips per year. So if a person needs to go, and I also want to mention, if a person goes to the doctor, they need to go to the pharmacy afterwards, that does not count against it. I know sometimes that does, but for ours, it does not. So all we ask is that the member calls 3 days in advance and requests their ride. And there's different options available as far as a sedan or a van. If a person needs wheelchair accessible, please let them know that when they call. That way there's no confusion or the wrong vehicle isn't sent for the person. Mileage reimbursement is also available to a family or friend who's willing to take them instead. And the vendor for that is Access to Care. The Purge benefit. So this is a good one. This wasn't one is something that we're excited about as well. We're excited about all of our benefits. We think we did a great job this year. So the Purge benefit is really, really fun. If we remember the whole commercial, I've fallen and I can't get up, a lot of people remember that. Well, the Purge benefit has been expanded, and this is a nice expansion. One of the benefits of the PERS now is if a person is lonely. There's so many things that's happening right now with COVID and different things like that.
Yes.
So yeah, so if a person—
I'm a big fan.
Are
Big fan
you?
of the PERS, yeah.
Yes, I think it's just so amazing. And I mean, as we used to just be able to push the button just because something happened, now they can actually call if they need help, or if they're lonely, or if they need help making a doctor's appointment, need help with making a transportation appointment, need help with getting their prescriptions filled. Whatever that looks like, the people are actually there to have a conversation with them. So this is one of the benefits that are really, really nice with the expanded PERS. Yeah, so that's available also for next year. And there are some qualifiers in order for the person to get the Purge. They basically must live alone or be alone for 8 hours a day, must have some type of ailment that causes it to be an issue if they are home alone, and they must have an emergency contact within reasonable distance in case something happens and someone needs to get to them. And a referral or PA prior authorization may be required.
Okay.
And Teledoc, again, you know, with COVID, some people are comfortable. They're still going out. They're still doing their thing. Some people not so much. And so it just depends on the person. Yeah. And it's just whatever makes sense for them is okay with us. So if a person is not comfortable going to their doctor, but they just want to go to the local or they just want to call and do Teledoc over the phone, we have that available with no copayment. And it is 24/7 care directly from the home. They can access, they can call or do it online, whatever works for them, works for us. And it's just a nice benefit at no cost. So if a person can't get out, doesn't want to get out, whatever the situation calls for, we do have that benefit available. Silver and Fit. So Silver and Fit has 14,000 locations. So that's super exciting. They can go to www.silverandfit.com, do the zip code search and find a facility that is local to them, that is close to them, or maybe somewhere that they currently go. Make sure it's a network, and all they got to do is show up with their Molina card, and they will print them a Silver and Fit card and be all set. And so that's a membership available to them at no cost. Or they also have the option, again, for people who are not comfortable getting out of the home. Maybe a facility is not within their distance, or whatever the case may be, they're able to get, just call in and get the kits available as well. So whatever works for them. If they want to go out, go to a facility, great. If they don't feel comfortable with that, they can have a kit delivered as well. Hearing. So the exam, the fitting exam, the hearing exam, there's no cost to the member. There's over 5,000 locations nationwide. And we really do have this down pretty good. Basically, it's a provider search, so they can call, find a provider. They get the exam at no cost. They get to order their hearing aids. They receive the fitting. And then if there's necessary for a follow-up visit or fine tuning, that is available for them as well. And they also get a supply of batteries. So this is a benefit that a lot of people take advantage of, and definitely something that we're proud to have as part of our portfolio. So this is our details. What is the product details? What is all this about? So the plan number for Ohio is H9955-001. Our maximum out of pocket for 2021 is $7,550. Our PCP copay is $0. Our specialist copay is also $0. The urgent care, there's no copayment or up to 20% with a maximum of $65 per visit. Now, this is a D-SNP plan, but we do take all levels of Medicaid eligibility. So you don't have to figure out, are they here, are they there? Can we only take this? We take all levels of eligibility. Again, some of these are a repeat. The dental is a $2,500 comprehensive. Vision is $300. Again, the hearing, you get 2 hearing aids a year. Over the counter is $350 per quarter with the carryover. Transportation, no copayment for the 0 one-way trips. We also have a meal benefit available. There's no copayment for a maximum of 56 meals. That is basically activated in case a person maybe goes to the hospital, has an overnight stay, has something going on, that once they're discharged, that will release out to our caseworker. Our case managers will get a hold of that member and find out what's going on, and we can activate that meal benefit if they would like. So that's something that's really nice and very happy to get behind. Again, our fitness copayment is $0 copayment, and it's Silver and Fit. And our tiers, tier 1, there's no copayment for our tier 1 prescriptions, and LIS accordingly for the remaining of the tiers. One thing that's not in here is CVS is our pharmacy, and it's also the online pharmacy as well. So that is something additional that wasn't actually in the slides, but CVS is our pharmacy. And this is my contact information. Again, I'm Latoya Whitfield, Broker Channel Manager for Ohio. If you need to reach me, my phone number is area code 418-9262. And there's my email there. It is longer than the alphabet. I looked at ways I wish they could have shortened it, but it is what it is. But you are able to email me or contact me by phone, whatever works for you. Our broker services team, that's the number to get a hold of if you have questions about certification, if you need to order supplies, if you just need anything, period, if you need to check LIS eligibility, do you need to see if the member is on or off, whatever's going on, our broker support team is there for you. Our member services number, whatever the member needs, they're available as well. And then our Molina Healthcare website, you can go on and search for doctors, search for pharmacies, all of that is available there. And then our Molina broker portal is down there at the bottom as well.
Perfect.
Yes, and this is just a couple of training links for anyone who may need it. Find a PC or find a primary care physician, find a pharmacy. DRX enrollment tools, people can actually enroll their members online. That's a 17-minute video there that is available. So that is also very helpful, and it kind of helps walk through the process. We also have our telephonic enrollment. So telephonic enrollment is available, and that's a video down there at the very bottom there that'll talk about the telephonic enrollment there a little bit in the scope of appointment process. So yeah, that is our 2021 benefits.
Wonderful. That's so great. I will add that, Molina being one of the more streamlined, easier companies to work with, the member services, the girls there are so easy to work with. They actually answer your questions, in an efficient way. If they don't have an answer, they will go research it for you and come back to you and get that answer the best that they can. So I'm a fan of that. I will back you up in that if there is a broker that needs any assistance, wants to learn a little bit more about DSNP, I do get back to brokers within 24 hours, so we won't leave them on unread or not called back. So I will make sure that anyone that does have questions, if they can't reach you, because I know you will be crazy during AEP.
Exactly.
I will definitely be here as another resource for them.
Oh, well, we
So,
appreciate that. Absolutely. And yes, I agree. We try to call people back same day, like you said, within 24 hours, because we realize AAP is a short window, and we do want to get everything in that we can. So yes, between the two of us, they'll get a hold of somebody. Absolutely.
right. And to keep in mind, any of the brokers that do come on board for Molina, or if you have been contracted before, you know that a DSNP product is a year-round selling opportunity. So if you are writing during AEP and you find that these individuals are on Medicare, Medicaid, or maybe on an LIS level, Molina does handle those levels. For more information on that, please either reach out to Latoria or to myself. My phone number again is 1-800-381-0977 extension 124. Check us out at www.iadbrokerage.com. Again, this is Yvonne Blanco from Insurance Advisors Direct. Thank you so much, Latoria from Molina, and I look forward to working throughout the rest of the year and for New Year to come.
Absolutely. Thank you so much too. You have a great day.
Okay, you too. Thank you.
Bye-bye.